I'm Dr. Sejal Sahita, Chief Medical Officer at In Your Skin, and this is Getting Comfortable in Your Skin. Today, I have two of my colleagues, Smita and Filsi, with me, and together we will be exploring the topic of hyperpigmentation through some question and answers and case studies. Hope you find this useful. Let's see if we can start with some questions.
Doctor, I have a question. We have been treating hyperpigmentation for many years. I would like to know more about this. वो क्या होता है, किस रीज़न से होता है?
That's a good question to start with. In simple words, hyperpigmentation is the condition where there is darkening or increase in pigmentation of the skin because of overproduction of melanin. Now, melanin is the pigment present in our skin that gives the skin, hair, and eyes their color. It is important to know that melanin is actually a vital component of the skin as it protects the nucleus of the skin cell from damage against UV radiation. This in turn protects the skin from conditions like skin cancer. But when the melanin levels increase in an uncontrollable manner, such that certain areas or patches of the skin look much darker than the rest of the skin, we call it hyperpigmentation.
We have seen this kind of darkening on every part of the body. तो इस सबको हम hyperpigmentation कह सकते हैं क्या?
The short answer is yes. So whether you call it dark circles, marks, spots, freckles, PIH, sunspots, all of these are different types of hyperpigmentation and are basically induced by increase in the levels of melanin in the skin. Even tanning or generalized darkening is a form of hyperpigmentation.
But doctor, exactly what causes melanin in the skin to increase so much? वो control नहीं कर सकते क्या?
There are actually multiple root causes for such hyperpigmentation to occur. Let's take some examples. Like for PIH, which is post-inflammatory hyperpigmentation, the primary cause for increase in melanin levels is the actual inflammation in the skin cells. Now, such inflammation can be caused due to bacterial growth in case of acne or may be caused by a physical wound. Whatever the cause, the net result is inflammation and the response of the skin to increase the melanin levels. Now let's take another example, underarms darkening. Now in this case, the root cause can be as simple as friction or shaving, basically some form of agitation. It could also be something far more intrinsic like Acanthosis nigricans. Now this may be because of many reasons, from being overweight to having hormonal disturbance in the body to even being insulin resistant. This is exactly the reason why I keep saying that not all hyperpigmentation is the same and that all of it cannot be treated the same way. Sometimes it may be better to prevent it, while sometimes it may be better to treat the underlying cause. Either ways, just simply using a cream or a serum is not the only way to help patients.
And I guess that's why patients should actually see a doctor about this rather than self-medicating or using OTC creams.
Absolutely.
Doctor, you said prevention is possible. Can you please guide us on this? Because patients keep asking us for the prevention tips.
Sure, Smita. But as I said, only some of the things can be prevented. Like in the case of PIH caused by acne, it is best to work on a simple skincare routine to keep your skin clear of dirt, grime, and excess oil. So there is no bacterial growth and hence no inflammation or hyperpigmentation. For something like freckles or sunspots, adopt a skincare routine that ensures your skin is always protected from the sun. You could use a sunscreen with SPF greater than 30 every time you step out, or wear long sleeve clothes, hats, and caps. These things can go a long way in protecting your skin. Even for something like dark circles and darkening of underarms, there are things you can do like avoid friction, use a moisturizer, or use a sunscreen. But it may not address the primary concern and hence will have very limited effect. Like if your underarm darkening is diagnosed to be Acanthosis nigricans, then it will involve a substantial lifestyle change from losing weight to controlling diet, etc.
What about treatment of these conditions?
I typically classify treatment into two ways, symptomatic and root cause treatment. Now, there is truth that whatever the type of hyperpigmentation is, can be symptomatically treated by trying to reduce melanin levels. For the same, there are oral medications, topical creams and serums, injectable treatments, and treatments with energy devices like laser. Now, for the root cause treatment, I would advise patients to seek out the help of a dermatologist who can help them first with an accurate diagnosis. This may even need some form of blood test, and then there would be medications that can be given to control the root cause. These medications may need to work towards controlling hormonal levels or reduce sensitivity of skin to certain external stimuli, etc. Lastly, but very importantly, the doctor can advise on whether a lifestyle change is needed to truly help with the issue. So guys, let's wrap up this session. What do you think?
Yes, doctor, this was quite interesting.
Absolutely.
I hope you guys too found this session useful. I hope we also answered some queries you may have in your mind. Till next time, stay happy and comfortable in your skin.